Hi everyone and welcome back to the Old School RN. I'm Deb, a registered nurse with over 3 decades of NHS experience, and this is going to be part 3 of my 4-part series examining NHS funding. I must have remade this video about 5 times because the more I was researching, the more I needed to add. So in part 1 and 2, I discussed NHS funding and how UK taxes and national insurance money, how it was spent in the NHS from 1948 to round about 1995. But when we went through as each successive government spent that money, we're now looking at the Gordon Brown years. And Gordon Brown became PM in June 2007, and he continued Blair's legacy of PFI. So his government from 2007 to 2010 resulted in NHS record budget increases and the mass construction of new hospitals by the private finance initiative. While his massive funding injection helped drastically to reduce waiting times, the heavy reliance on PFI saddled the NHS with massive long-term expensive debt. And that's the important part. The NHS budget was not cut in the same way as any other public service. In fact, NHS spending continued to rise in cash terms. And remember in my last video I mentioned about Private Finance Initiative, or PFI, because this allowed private consortia to build and manage dozens of new NHS hospitals. But while it delivered modernised infrastructure, critics would argue the contracts were economically ruinous. They required taxpayers to pay back significantly more than the original construction costs over 25, 30 or more years. So this private sector integration under Brown's premiership, the NHS started utilising independent sector treatment centres to perform routine operations, and patient choice was drawing criticism from trade unions as being about creeping privatisation. Then came along David Cameron's government, so 2010 to 2016. And this historically showed increases and severely squeezed finances compared to historical standards. And this contributed to the tightest financial settlement ever since the NHS started. And the Institute for Fiscal Studies reported how in real terms, NHS spending and growth averaged around 1% annually during the early 2010s, far below historical averages. And I know that's linked to 2008, but that's another subject. We'll keep to this one. But that distinction will matter. More money was being spent, but the claim was that demand was rising faster. And the reasons the public were given were: 1, the population was growing; 2, people were living longer; 3, medical treatments and medical research were becoming more expensive; 4, social care budgets were under increasing pressure. And I'll come to that again in a minute about social care. And many NHS leaders argued that while funding rose in real terms, it didn't rise sufficiently to meet the growing demand of staff wage increases and social care. And the supporters of austerity argued the country simply could not afford spending increases that had been seen during the Blair and the Brown years. Now, 2010 to 2011, the total UK NHS budget was approximately 131 billion. I can't even imagine that number. The coalition government had ring-fenced the health budget from the deep austerity cuts applied to other public services, keeping NHS spending broadly flat in real terms per head of population. So the 2010 to 2015 David Cameron Parliament then became a parliament of 2 halves for the NHS. The first half dominated by the debate of Social Health and Care Bill, which was designed to devolve decision-making and put GPs in control of buying services. And the second half was taken up by limiting the damage caused by that bill, with greater emphasis on competition and greater efforts to strengthen regulation and quality of patient care and prioritise patient safety, i.e. CQC. It introduced significant structural changes in the NHS, including the establishment of NHS commissioning groups, clinical commissioning groups, or CCGs, and they replaced the previous primary care trusts. So what did that do for staff? Well, it lowered pay. For doctors and registered nurses, that pay went down significantly, and we've still not caught up even now in 2026. And what did it do for our patients? Well, the Health and Social Care Act 2012 impacted on patients by widening their right to choose healthcare providers legally, but simultaneously fragmenting their day-to-day experience of care. So NHS trusts have been left with massive ongoing liability, with estimates showing they'll pay 80 billion for every 12 billion worth of initial money invested. And paying off all these inflated charges, along with all the change in management of funds, was draining resources away from frontline patient care. So PFI severely hit the NHS in a doom loop, and that affected other sectors. So local authorities that handled adult social care were in a financial vice, because you've got people going to one area for treatment and coming back for their social care. Funding versus demand and inflation, that failed to keep pace with soaring inflation and demographic pressures. So the government decided to change how GPs and the community worked and how they were funded again. And this newly named commissioning was the process of the planning, further buying and further monitoring of healthcare services. So also during this time, NHS organisations were increasingly expected to find efficiency savings from the money they were given. And many people will remember terms such as transformation costs, improvement programmes, productivity targets, and how hospitals were asked to deliver more activity with fewer resources. More activity means patient illness, patient treatment. Managers then became increasingly focused on length of stay in hospital, bed occupancy times, workforce costs, agency nurse spending, because they needed more staff to complete these targets, performance targets for frontline staff, which translated into fewer work colleagues, higher workloads, higher acuity, and greater pressures. So for many nurses, doctors, and allied health professionals, we felt those financial targets, and they were increasingly driving operational decisions. Meanwhile, executives were under pressure from regulators, NHS England, and these commissioners in the community to balance budgets. And the result was often tension between financial control and frontline capacity. That said, NHS transformation started to develop things like transformation teams, NHS Digital, NHS X, and NHS Corporate, and they continue to grow. They've never had issues around finances as far as I'm aware. So these new commissioners, they looked at local health data to see which services were required, i.e. one area, do they need more diabetic clinics or better maternity care? Maternity care is another video for another day. They decided how to meet those needs and design those needs for those services, but in a more fragmented way compared to the 1948 to 1995 budget and management structure, where health authorities did this in a more simple fashion. So GPs were reducing their clinical time in order to attend admin for CQC meetings, commissioning services, and provider contracts for things like NHS hospital services, ambulance trusts or private companies to ship patients from hospital to clinics, etc. They were needed to help deliver care as well in the community. And the check that the providers were to deliver safe, high quality care had to come in with those budget limits. And that meant a change was needed to manage these decisions. So in 2012, the Health and Social Care Act introduced one of the biggest reorganisations in history, true clinical commissioning groups, and they were to replace all of the primary care trusts. So from April 2013, GP-led commissioning groups now became responsible for all commissioning services within NHS England. Scotland, Northern Ireland and Wales, slightly different, so I'll keep to England for now. And in their mind, the theory was considered simple. GPs now understood local patient care needs, and they're in a better position to make commissioning decisions than large central organisations. So these CCGs now controlled bigger, substantial budgets, and they purchased more services from NHS trusts, NHS Foundation trusts in particular, mental health services now as well, and other independent providers. And critics argued that this commissioning model became more and more complex and again was the start of community privatisation. But supporters of this argued that local clinicians gained better influence over their healthcare budget and spending. And yet many frontline staff didn't notice those changes at first because patient care became largely delivered by the same hospitals and community services. But behind the scenes, billions of pounds were moving through increasingly complicated and even more complicated commissioning structures. And this model continued under the next Prime Minister, who was Theresa May, and her government, who then backed something called the NHS Long-Term Plan. And that aimed to integrate health and social care and ring-fence growing budgets for mental health and community services again. So it was like a devolved system. So under Theresa May, the long-awaited social care green paper, or a draft proposal, it was intended to overhaul funding and the delivery of that funding. It was repeatedly delayed in Parliament because Brexit was more of a concern for the government, and so the social care green paper never was actually pursued. As a result, social care services faced massive funding deficits. Cash-strapped local councils, who were then brought in to use their budgets for this care too, were increasingly given lots of red tape in order to save money, and organisations warned of an impending catastrophe because we're having meetings and meetings, but nothing was actually being delivered. So without any clear structure or structural reforms, because the Green Paper wasn't aired in Parliament, this crisis fell onto local authorities with unpaid family carers, private care providers to absorb the day-to-day shortfalls. And the dementia tax was brought in, or selling your private home to pay for care in a care home. That became an issue. And then we had Boris Johnson's government, who succeeded Theresa May, who pledged a multi-year real-term increase to NHS budgets. His key financial actions from his government included long-term plan funding, locked in a legal commitment for a phased spending increase of something around 20.5 billion in real terms for NHS England by 2023-24. That didn't happen. We all know why, COVID, etc. The capital boost that Johnson announced were 1.8 billion one-off cash injection in August 2019 for urgent infrastructure and equipment upgrades across 20 hospital trusts. And he made a 40 hospitals pledge, committing an initial 2.7 billion investment to launch the healthcare infrastructure plan, promising to build 40 new hospitals by 2030. Still not there with that either. But then came 2020, and nothing in NHS history had prepared a modern healthcare system for what happened next. That is a whole other issue, and I'll continue that in part 4 because NHS finances, and I've only skimmed over the top, it's a massive subject. So if you've liked this channel, don't forget to like, subscribe and share, and let me know in the comments, has NHS funding been a problem or primarily about money, or is it how the money's spent? Thanks for watching the Old School RN. I'll come back with a part 5, and if you want a deep dive on any of these subjects, I will make specific videos for that.